This is a unique healthcare proposal with 4 innovations. I call it the Responsible Care and Tax Allocation Act. One innovation is a cash reward to the patient for shopping for below average prices. Another is to open up healthcare procedures and pharmaceuticals to global competition. A third is to immediately cut 50% off healthcare costs by chopping the overheads of insurance and lawsuits. A fourth is to allocate portions of discretionary tax revenue for all public benefits, including healthcare, via a public referendum. Our current healthcare is a broken, bloated hodgepodge of Obamacare, Medicare, Medicaid, and employer-sponsored systems. Replacement plans can't pass Congress because they don't cover all, don't control cost, or are contortions to placate ideologies and special interests. I propose to free Congress from its dilemma with this plan that offers smaller government to conservatives, coverage for all to liberals, and far cheaper health care to consumers. It's a combination of appealing components with minimum pain to enable congressional approval. The concepts of the act are easy to understand, but this is not to say the details aren't complex. The key goals are 1. Cover all citizens. 2. Pay for it using a vote for allocation of tax dollars. 3. Stretch that allocation by reducing healthcare overheads. 4. Give patients and doctors absolute control and responsibility for their healthcare decisions. 5. Drive down provider prices by globalizing healthcare and incentivizing patients to seek lower prices. And finally, 6, simplify healthcare by consolidating current multiple healthcare systems. These are not utopian goals. Most are commonly called for. They are realistic goals when the root causes of impediments are understood and taken out. I'll first elaborate on Goal 3, reducing healthcare overheads. Non-Medicare healthcare is a $2+ trillion industry. Other countries do better with less, meaning billions are being wasted. The overheads of insurance companies and in dealing with same are said to be 30%. The losses due to lawsuits and fears of same are said to be 25%. These inefficient and shameful expenses can be stopped with a sweep of a bold hand of legislative action to save 50% or $1 trillion in healthcare cost. For a family, their $12,000 payment is slashed to $6,000, and that is just the beginning. Make no mistake, those cut out of this much money will be hot as hornets. But this is your money and your health care, and we must act en masse to overpower political ignorance and special interests. Under current ACA law or Obamacare, insurance company overhead is limited to no more than 20%. But there is also a high cost to providers to deal with insurance companies, and that is where the total 30% figure comes from. On the other hand, some estimate the overhead of our single-payer Medicare system is only 2 to 3%. Some say this is low, so I'll say there could be a net savings of 25% to eliminate insurance companies. Insurance companies will have the option to be transformed into much simpler and smaller payment agencies. Recently, a TV news contributor claimed that 25% of healthcare cost is related to medical lawsuits. I'll leave it to the critics to prove any of these percentages are wrong. But these overheads are most certainly a very big nugget that other countries don't suffer and that can't be ignored if we are to have a workable system in the United States. Medicines and medical procedures entail risks. If lawsuit costs are to be reined in, patients must take full responsibility for their healthcare choices. A key component of the Responsible Care Act is to give consumers ready information to make those choices. Websites will be created to make it easier to locate and compare providers. Provider prices, education, experience, certifications, and performance scores and patient testimonials will be posted. In the cases of products and pharmaceuticals, their prices, benefits, testing, side effects, etc. will be posted. In the case of products and pharmaceuticals, standardized numerical codes for procedures and medicines will be available to aid the search and comparisons. All healthcare procedures and pharmaceuticals will be open to global competition. Globalization has been remarkably effective in slashing the cost of consumer goods and raising quality. So let's apply the same rules to the healthcare industry. A patient's choice of provider or product is his acceptance of the risks of the choice. Patients who can't make those choices should consult their GP or advocacy groups. Providers and products that fail to maintain qualifications and threshold performance grades will be decertified and dropped from the websites. Outcomes and testimonials will be reported to oversight agencies. Medical lawsuits will be eliminated except for cases of fraud as determined by the oversight agencies staffed with medical and financial detectives. The above Goal 3 to cut overhead not only cuts our healthcare costs in half, but also achieves Goal 4 to give patients and providers sole control of their healthcare decisions. Goal 3 also helps achieve Goal 5 to drive down prices. Patients will choose any doctor or hospital and deal directly with a doctor to decide proper care. Patients will shop providers of care and pharmaceuticals on the websites for the best value and pocket the difference between the price they pay and the average of prices posted on the websites. The flip side of this reward is a penalty. If you pay a higher than average price, you will pay the excess out of pocket directly to the provider. The reward or penalty will motivate the patient to seek the lowest comfortable price. Providers can hold to published prices or be open to negotiating a lower price. Patients will be able to solicit bids for the best price and schedule. All payments, whether posted, negotiated, or exceeded, will be used to continuously recalculate the average of prices paid for that procedure or medicine. The payment agency pays the provider only the lowest of the negotiated price or the provider's posted price or the average of posted prices. As the averages of posted prices are driven down, providers will need to correspondingly reduce their prices to maintain competitiveness and reduce their costs to maintain profits. Without the threat of lawsuits, providers will save on liability insurance and on excessive costly testing to protect against lawsuits. Patient and doctor will decide what testing is judicious. Information on procedures and customary testing will be available on websites for the patient to review what is typical and what is adequate for them. Goal 6 calls for consolidating our healthcare systems. Businesses now spend large sums for employee premiums and overheads to administer them. Under the Responsible Care Act, business will no longer be involved with healthcare. As a result, U.S. business will be more profitable and globally competitive. Without the burden of providing health benefits, small business can better compete with large business. The chokehold of regulations pale in comparison. With healthcare no longer connected to business, employees will have portable healthcare that is not at risk with job loss or job change. All citizens will be covered regardless of job status. Individuals will be able to buy additional private, unlimited, supplemental insurance, but business and government will not be allowed to offer or subsidize insurance even to CEOs or members of Congress. Because the Responsible Care Act covers all citizens, the Medicare and Medicaid programs will be rolled into it. 50 different state bureaucracies and policies will be eliminated for additional large overhead savings and elimination of complexities and inequalities over who is covered for what depending on age, income, job status, or where you live. Now all citizens are covered by one system and goals 1 and 6 are realized. With goals 1, 3, 4, 5, and 6 explained, how do we achieve goal 2 to pay for health care? To this end, I propose the Responsible Tax Allocation Act. The act has 2 components. One is a vote to specify a total tax revenue goal, and the second is a vote to allocate how the discretionary portion of that revenue is to be spent. The revenue vote will set the target for total amount of taxes to be collected at perhaps some percent of GDP and perhaps relative to the average of developed nations, so this country remains competitive with the rest of the world. The allocation vote will be by means of a ballot. The ballot will include perhaps a half dozen broad spending categories such as for defense, infrastructure, education, housing, healthcare, and for subsidies such as for science and arts, etc. There might be any number of subcategories, Current spending on these categories will be shown on the ballot with adjacent spaces for the voter to specify his preferred allocations for the next fiscal year. Every state and federal representative and senator will vote on these, and there will be a similar annual referendum for the public to vote its preferences. Every budget year, Congress will debate both the public and congressional referendums and then vote to adopt one or the other or a compromise. A similar ballot will be added to our tax returns to hear the voice of taxpayers. The tax ballot will allow for an additional voluntary contribution directly to categories held most dear. This may sound ludicrous, but it will be symbolic of one's depth of personal commitment to heartfelt issues such as health care or defense. The impacts of allocations will no doubt influence future allocations as the public learns how the system works and how it affects their lives and security. Congress will determine how to distribute the available allocations. In the case of healthcare, practical individual limits will be set, including for extraordinary efforts to sustain life, because more to some will mean less to others. Such a decision would be an excruciating task for any one individual or group, but the public allocation will unload responsibility from Congress directly onto the public conscience. The public must accept the coverage limits or pony up more money by referendum. Even those that don't pay taxes will choose what other government benefits they will sacrifice if they want more healthcare dollars, because all the benefits are funded from the one limited tax source. Coverage limits will be supplemented by philanthropic websites to match appeals with donors. As a practical note, a means of adhering to the revenue referendum while dealing with economic booms and busts will also need to be worked out by Congress. Public allocations will be a true measure of the public's sentiments. Healthcare and other federal programs will need to compete for the public's choice in spending priorities. The will of the people will set the priorities of the nation. Supporters of each category will need to accept the will of the people and check their arrogance that they know better than the people what is best for this country. What is best for any country is to always follow the will of the majority of the people. The will of the people will be the responsibility of the people and not the fault of government. To those against a tax-funded system, I ask, by what measure is $6,000 in taxes with downward pressure worse than $12,000 in premiums with upward pressure? Currently, what the people want is not clearly expressed. There is a lot of noise for healthcare and defense and so much else, but no way to objectively express those opinions. We elect officials for their effectiveness in bringing home federal dollars, or for their party affiliation, or for their positions on issues, all of which can change after their election. We then coerce officials and condemn them for their pocketbook decisions. The Allocation Act will bring our government closer to a system of pure democracy by directly expressing the public's choice for tax goals and for spending priorities for elected officials to follow. The Allocation Act will tend to cripple politicians from buying votes with promises of more spending. On the flip side, the Allocation Act will free politicians from the political fallout for their spending decisions. Politicians will now be elected more for how they contribute to make government work better. In addition, with less power to influence spending, special interests will now be less interested in bribing politicians. Special interests will be more inclined to advertise to sway the public, but at least their efforts and expenditures will be in full public view. Under the Responsible Care Act, the patient's health care dealings will be simplified, with no premiums or copays or renewals. The patient's GP will continue to be his prime provider, as well as his advisor and coordinator for specialty care. The doctor's dealings will be vastly unburdened. The basic structure of the system will be as follows. Healthcare is financed by the allocation of tax dollars. Congress sees to the establishment and monitoring of competing private payment agencies, oversight agencies, advocacy groups, and websites. Congress specifies individual benefit limits with a formula based on the current available allocation. Patient history will be maintained within the Social Security system, where the patient's expenditures are shown, as well as his personal limits based on the available allocation. The patient's doctor provides prescriptions as usual. The patient can work independently or with help from his doctor to select medicines and providers using the websites, and then check the Social Security database to confirm the medicine or procedure is qualified. The patient accepts or negotiates a deal with the provider for best price and schedule. The provider submits his bill to the payment agency. The payment agency sends the lowest of the average, posted, or agreed price to the provider and pays the savings to the patient. The patient must pay any above average cost out of pocket to the provider. Any unqualified procedure or medicine can still be purchased out of pocket or by supplemental insurance as long as it is prescribed by the doctor. Payment agencies are reimbursed by the government for payments made. Oversight agencies tabulate outcomes and review complaints. Both the healthcare plan and the tax plan have responsible in their names to be honest about what is required to make any system work. Affordable is not in the names because few would prefer to pay any taxes before endless possible pleasures. All must participate, contribute, sacrifice, and share risk, just like life itself, if we are to function and survive as a nation and perfect our ideals of fairness, equality, and responsibility. The Responsible Care and Tax Allocation Act will shrink and streamline government while satisfying the public demand for a tax-funded universal health care system. This plan not only solves a health care crisis, it solves a spending crisis, and most importantly, a critical governing crisis. This presentation is by practical necessity under 20 minutes long. Any healthcare law will be extremely complex. All the details will require at least hundreds of pages. The purpose of this presentation is to present simple to understand principles upon which the law will be based. The principles illustrate the humanitarian and practical objectives and provide a framework or roadmap for the details needed to meet these objectives. Hopefully this presentation will start a discussion on the pros and cons of these concepts so the proposal can be made more workable and most satisfactory to all. To Democrats, I say, you succeeded with Obamacare to bring universal health care to this nation. There is a lot in this plan for you to like, so yield on tort reform and limits on benefits. To Republicans, I say, the popularity of tax-funded universal health care is a steamroller you can't stop. So use this opportunity to get smaller government and spending controls throughout government. Give up insurance companies that embrace single payer with tax allocations. To the public, I say you insist on single payer universal health care. But you must prioritize this with other benefits you get and pay for it all. To Congress, I say you must make healthcare an efficient and responsible system, so pass this plan to save your jobs and restore faith in government. Here is a summary of the advantages of this proposal. Coverage for all, shrunken government with spending controls, costs immediately cut in half by overhead reduction, costs continuously reduced by globalized market forces, simple patient-doctor interaction, no mandates or pre-existing conditions, and equality, fairness, and responsibility for all. For these ideas to gain traction, please help get this message to mainstream and emerging media and directly to political leaders, family, and friends. Please offer your criticisms to improve this plan. Thank you for your attention and input.